I'm Shannon Weber with HIVE, a hub of positive sexual and reproductive health, and I'm here in Vancouver, Canada at the International AIDS Conference. It's July 2015, talking with Lynn Matthews. Will you introduce yourself?
Yeah, thanks. So I'm Lynn Matthews. I am a physician in infectious disease, and I work at Harvard Medical School and Massachusetts General Hospital in Boston. My research is based in South Africa and Uganda, and is really focused on safer conception.
Yeah, you've really been a leader in this field, trying to help us understand what the options are and how people do want to have babies and what are the ways that it can be presented to people so they can make decisions.
Thank you.
And we've known each other for years and really been working together recently around this WHO work of trying to figure out how do we make some guidelines or some principles or an algorithm that's helpful both to providers and to patients about safer conception options. So I wanted to ask you, what are some of the most common questions you get and your answers? And these are consults you get from all over the world. And you said really common question, which is also similar to us, is what do you do in the setting when the man has HIV and his viral is undetectable? What's the role of sperm washing? What's the potential role of PrEP?
Right. And even I get the question a lot in settings where they can't check the viral load. So they know that there's an infected man and an uninfected woman. He's been on treatment for a long time. He's doing really well. He's had immunologic recovery, but they don't know what his viral load is. And so the question is often, what is the role of sperm washing? And I think that, we are never going to have a randomized controlled trial of kind of male positive serodiscordant couples where we offer sperm washing or sperm washing plus ART for the man, or sperm washing plus ART and PrEP, or ART alone or PrEP. Like, that's not going to happen. So we have to go with what we have. And the evidence about the efficiency of ART, effective ART for reducing viral load and reducing transmission is really profound. Transmission risk is reduced dramatically. There's even more data from HPTN that I have to tell us that. And sperm washing, we also have great data, is very effective. There's many cases now of sperm washing plus effective decent pregnancy rates with zero transmissions.
Right, thousands of cycles.
Yeah, 40,000, many cycles. And so the question is, do people really need to do that? And I think it comes down to a discussion with patients who are coming in about what they are comfortable with. I think if people are comfortable with the risk reduction that is associated with treatment for the positive partner, then limiting sex without condoms to peak fertility is probably a really efficient way for them to become pregnant. They can do it at home. They don't need to go to a center. They don't need to produce a semen sample, and pregnancy rates are good. If that makes people nervous, if they have the option of PrEP for the uninfected woman, then that adds an additional layer of protection, particularly if she's not sure that her partner is going to be adherent to ART, or if she just wants to have some control that she's in charge of and not relying on her partner. Adding sperm washing to that, or adding sperm washing to ART for the infected partner, adds more protection, but it's really difficult for many people to access.
Right.
And the pregnancy rates mean that you need to go for a few cycles, and that can be really difficult for people.
So you're really presenting this in a way of putting out the options that are available and then helping the couple to sort out what works best for them based on their perception of what risk or their willingness to take risk.
Yeah.
So I want to ask you then, what about the role of condoms? Because in so many settings it's been condoms only messaging, and so some clinicians can feel anxious about shifting that conversation. Also, some patients or some couples can have trouble even bringing forward and talking about having sex without a condom. Talk to me about that.
Yeah, so I think that our messaging around HIV prevention has been and is really focused on condoms. And I think that providers are anxious about sharing the message that, well, maybe not using condoms is okay if you're doing these other prevention strategies. Certainly it's okay if you want to have a kid. That makes providers really anxious. And so when I get emails from around the world asking, like, what should I do? What should I tell them? I try to really congratulate the providers for having the conversation and reminding them that, in the absence of safer conception advice, this couple is still going to have a baby, because it's really, by the time they're bringing it to their provider in a setting where they don't know that that's okay, they have been thinking about it for a really long time. So they're having sex without condoms in all likelihood.
Yeah.
And so you can offer these other prevention messages to help them achieve their goals while minimizing the risk of transmission.
And stay in care. too,
and stay in care and feel like
invited in.
They're respected and their reproductive goals mean something and are important.
Yeah.
And they're not just supposed to say, oh, we're not going to have kids because we have HIV in our lives.
Yeah.
That doesn't really make sense anymore.
So when do you think providers should have these conversations with couples? You're saying and pointing out it takes a lot of guts in many ways by the time the patient comes and brings it forward. So what advice do you offer to clinicians around that?
Yeah, so I think that lots of our data from Uganda and South Africa and many others show that it's tough for providers to bring this up. They don't have a lot of guidelines for when to do it or how to do it, and they're not totally sure what to say. So they kind of wait for the patients to bring it up. Patients aren't bringing it up because they think they're not supposed to talk about it because they've been told, use condoms, use condoms, use condoms. So I think it makes a lot of sense. I know it's hard, providers are asked to do so many things, but to talk about it early and often. So, kind of in an initial HIV consultation visit as part of all the other prevention counseling that happens, say, and by the way, when you've been on treatment for a while and you're doing really well and feeling great, your plans for having a family may become, something you really want to think about at that time. There's lots of things we can do to allow you and your partner to get pregnant safely with minimal risk of transmission to the uninfected partner, to the baby. We can talk about it. I think that's like the three-liner that providers can give. If they had time, I think it would be nice to actually say what those methods are, because I think if clients feel like that's going to be really complicated and really difficult and involve sperm washing and assisted reproductive technology and going to other cities, they might actually not want to bring it up. They might just want to take care of it on their own. So even something as simple as once the infected partner is on treatment with a suppressed viral load, it's probably a pretty safe time to have kids.
And that you want to know about it. I love
simple.
this idea of just that you would be open to hearing about it as a provider. You want them to come back.
Yeah. So many of the clients who we have done qualitative interviews with and focus groups with talk about this, or even at our satellite session just the other day, a woman from the International Community of Women Living with HIV was talking about how hard it was to be a pregnant positive woman and not wanting to tell anybody about it because of the stigma associated with that. So if people can get information, know that it's okay to get pregnant, it's okay to get your partner pregnant, and there's a whole bunch of things you can do to protect them. It kind of moves the whole PMTCT timeline up. So I like to think about it. Right? We want the positive pregnant woman to come into clinic, but what about the uninfected woman who wants to get pregnant with a positive partner?
Please come
that would
into
be a
clinic,
great person to see too.
Yes.
Do a lot for them.
Beautiful. Thank you so much.
Thank
you for all your work.
I look for all you
look forward to much more.
Me too.